residency program came about for a variety of needs. The patient population that we serve has intricate and unique needs, and we found that giving additional training to our providers would really help to meet some of those needs. We also were thinking about new graduate nurse practitioners and helping to make that transition from academia into practice. So we looked around, learned about a lot of other residency programs throughout the nation, and decided to build our own. We're actually the first nurse practitioner residency program in the state of Missouri at an FQHC. So we're really proud of that and really hopeful that we're training the next generation of providers that can help with our community. The nurse practitioner residency program is a full year program, 12 months, and our residents are full-time providers. They have a 5-day-a-week schedule, and on 2 of those days, they're seeing patients off of their own schedule, where they're building a panel and they're creating those relationships with patients and following up with them. Another day of the week, they work directly with a preceptor, who is one of our advanced providers, and they're seeing patients off of their schedule, focusing on certain diagnoses that they'd like more practice with. We also have 1 day a week where our residents go through specialty rotations. And on those specialty rotations, they'll rotate through the specialists that we have here at our health center, but they also rotate with community partners and learn more about specialties that we often refer to as family practice providers. The last day of the week is their didactic week, where they're learning about in-depth diagnoses, looking at complicated cases, also learning about the community, and doing a lot of things related to social determinants of health and culturally competent care. We currently have 4 residents in the Samuel Rodgers Nurse Practitioner Residency Program.
So I knew that I wanted to be involved in a nurse practitioner residency program because I knew that I wanted to have the support needed to transition into practice. And then I found out about Sam Rodgers because I was actually a patient here, and I am familiar with the care that was provided. My teacher actually let us know that this residency was available, so I applied and was thrilled to be able to join.
So what influenced me to choose the Samuel Rodgers Nurse Practitioner Program was initially my experience here as a nurse practitioner student with one of the primary mentors in the program. It's really taught me to be a compassionate and caring provider, and taught me how to care for patients from different backgrounds and give culturally competent care to a variety of patients.
So the Nurse Practitioner Residency Program has impacted me in different ways. I've found myself becoming more involved in the community, learning more about our patient population, and trying to place myself in their shoes in general to provide the best possible care. I feel like my biggest lesson and takeaway from this program has been just knowing that I don't know everything and knowing what resources to go to in order to take care of my patients in the best way.
So one of the biggest takeaways I have gotten from this program is never to make assumptions of patients or coworkers, and always to give them the benefit of the doubt and ask questions when I'm unsure about patient's understanding of a subject, and to just always be compassionate towards our patients.
So a patient that I won't forget caring for when I was here would have to be a patient that felt like she wasn't being seen by any provider, though she was being seen. She didn't feel like she was able to present her full self to her previous providers, but because I was able to take the time to listen to her because of the time that we're afforded during this program, we were able to address multiple things that were going on with her. We were able to reduce her diabetic levels and also help her treat her depression.
So after the residency program is completed, I will actually be staying at Sam Rodgers as a full-time provider. I'm very excited. I'm also planning on doing a Spanish immersion program to become more fluent in Spanish so that I can better care for our patient population.
We're seeing a lot of benefits from this program. Our patients have easier access to care. Our residents usually have appointments that are open so patients can be seen quicker. We're also seeing great impact on their health measures and quality measures. We do focus in our didactic sessions on teaching our residents about the health quality measures, so that does impact the health outcomes of our patients. Additionally, our providers that are in the residency program are really falling in love with the community, and we're hopeful that they'll stay in community health centers long-term. What's next for our nurse practitioner residency program is that we're going to continue. We're going to keep adding residents to the program. hopefully 4 every year and potentially adding more. We even would like to consider thinking about residency specialties. And as we're building a new pediatric wing, we might need more pediatric providers, and so that might be something that we are looking at focusing on. So the long-term vision of our residency program is to create culturally competent professional providers who can take care of the community that we serve here, and who will also stay in community health centers and focus on serving the underserved for their careers.